Healthcare in America, Structural Reform Playbook, Post 1, Administrative Oversight and Waste Reduction. The U.S. healthcare system is enormous. It works, but it also carries layers of administrative complexity that drive cost, slow care, and frustrate patients. The good news? Some of this friction can be addressed without overhauling the entire system. Why oversight matters. Administrative tasks, billing, claims processing, coding, approvals are necessary, but studies show U.S. administrative costs are roughly double those of comparable countries. That's hundreds of billions of dollars each year that could be redirected toward actual care. Even small improvements in oversight and efficiency can have immediate, measurable impact. Key levers: streamline claims and billing, standardize forms and electronic submissions, reduce redundant approvals and prior authorization bottlenecks, encourage faster reconciliation of payments, audit administrative waste. Identify duplicated services, double billing, or unnecessary bureaucracy. Focus on high-cost providers and high-volume claims. Track savings and reinvest them in patient care. Simplify coding and reporting. Standardize medical codes, reduce errors and denials. Training and technology investments can cut hours of administrative work. Clearer documentation improves patient experience and staff efficiency. Why this matters for patients. Faster claims and billing reduce confusion. Less paperwork for providers frees up time for patient care. Savings can improve access, staffing, and resources. Administrative reform is not flashy. It won't make headlines, but it works quietly and it works fast. It's a foundational step toward reducing cost and improving care without needing politics to change overnight. Next in the playbook, price transparency and negotiation, where we tackle one of the most visible frustrations for patients: confusing costs and unpredictable bills. Reform posts will be 1. Administrative oversight and waste reduction. 2. Price transparency and negotiation. 3. Integrated care and coordination. 4. Incentive alignment for prevention and chronic disease. 5. Rural and underserved access. 6. Technology and telehealth optimization. Healthcare in America, Structural Reform, Playbook Post 2. Price transparency and negotiation. Even with insurance, many Americans are surprised by healthcare bills. One visit, one test, one procedure, and the costs can feel like a mystery. Price transparency and negotiation are levers that can fix that without upending the system. Why transparency matters. Patients rarely know the true cost of care until after the service. Insurers, providers, and pharmacy benefit managers negotiate complex contracts that are invisible to patients. Confusing bills reduce trust and make it harder to choose cost-effective care. Making costs visible empowers decision-making for patients, employers, and even smaller providers. Key levers: publish standardized prices. Hospitals and providers should clearly list costs for common procedures and services. Patients can compare in-network and out-of-network pricing before care. Simplify insurance coverage explanations. Standard summaries of deductibles, copays, coinsurance, and coverage rules. Easy-to-read formats reduce mistakes and surprise bills. Encourage negotiation and bundled payments. Regional or employer-level negotiations can lower costs for common procedures. Bundled payments align provider incentives with outcomes, not volume. Why this matters for patients. Fewer surprise bills and unexpected out-of-pocket costs. Clearer choices when selecting providers or treatments. Stronger leverage to choose value over volume. Price transparency is not about free market ideology. It's about clarity, fairness, and predictability. When patients see costs clearly, the system becomes easier to navigate, and wasteful practices are exposed. Next in the playbook is integrated care and coordination, a deep dive showing how putting services under one roof, or at least in a coordinated network, can improve outcomes and reduce duplication. Healthcare in America, Structural Reform, Playbook Post 3, Integrated Care and Coordination. The U.S. healthcare system works, but often in fragments. Patients move between hospitals, clinics, specialists, and pharmacies, and each transition creates duplication, delays, and cost. Integrated care offers a structural solution, connecting services under one system or coordinated network. Why integration matters. Fragmented care drives redundant tests, inconsistent records, and delays. Chronic disease management suffers when providers don't share information. Rural or smaller hospitals struggle to provide comprehensive care without support. Integrated models, like Kaiser Permanente or other vertically coordinated systems, reduce these frictions by aligning care delivery, records, and financial flows. Key features of integrated care. Shared electronic health records. All providers within the network can access patient histo. RI reduces repeated tests and improves treatment consistency. Coordinated care teams, physicians, nurses, pharmacists, and specialists collaborate, focus on patient outcomes rather than billable procedures. Streamlined financial flows, centralized billing, and contracting reduces administrative burden. Clearer incentives for prevention and long-term management. Monitoring and accountability, data-driven tracking of outcomes and efficiency, encourages continuous improvement without adding complexity. Why this matters for patients. Fewer redundant tests and appointments, smoother navigation through the system, better management of chronic conditions and preventive care, potentially lower overall costs, even within existing insurance structures. Structural insight. Integration is not a cure-all, and scale can create new challenges, like monopolistic pricing. But when paired with oversight, transparency, and incentive alignment, integrated care provides a measurable path to efficiency and better outcomes. Next, we'll examine incentive alignment for prevention and chronic disease, a tight post showing how small shifts in payment models can improve health outcomes while controlling costs. Healthcare in America, Structural Reform, Playbook Post 4, Incentive Alignment for Prevention and Chronic Disease. Chronic disease drives the majority of U.S. healthcare costs. Managing it is not just a clinical challenge, it's also a matter of incentives. Even small changes in how care is reimbursed or structured can produce better outcomes and lower costs. Why incentives matter. Fee-for-service models reward volume, not long-term health. Preventive care, counseling, and lifestyle support are often undervalued financially. Patients may delay care or skip follow-ups because short-term costs are unclear. The result: high spending, fragmented management, and preventable complications. Key levers. Reward preventive care, screenings, vaccinations, counseling, and early intervention payments tied to outcomes, not just visits or procedures. Support chronic disease management. Encourage care teams to coordinate long-term plans, incentivize adherence to treatment and monitoring programs, align patient behavior with health goals, use tools like health coaching, reminders, and education, reduce barriers to preventive visits and healthy lifestyle adoption. Why this matters for patients. More attention on prevention and long-term management, reduced complications and hospitalizations, lower out-of-pocket costs over time, greater clarity and consistency in care. Structural insight incentive alignment does not require a system overhaul. Shifting focus from procedure volume to health outcomes produces measurable improvements. When paired with integration and transparency, it closes the loop between dollars spent and health achieved. Next in the playbook, Rural and Underserved Access, a deep dive showing how structural levers can protect vulnerable communities and preserve essential services. Healthcare in America, Structural Reform, Playbook Post 5, Rural and Underserved Access. The healthcare system functions differently depending on geography. Rural and underserved communities often face the highest friction and the least margin for error. Structural reforms here can make a real, tangible difference. Why rural access matters. Rural hospitals are smaller and see fewer patients, making them financially vulnerable. Administrative complexity, rising costs, and low volumes can force closures. Residents face long travel times for basic care, emergencies, or specialty services. Even small structural adjustments can preserve access and prevent critical gaps. Key levers. Support small hospitals and clinics. Scalable administrative support reduces overhead. Shared billing, coding, and claim systems lighten the burden. Focus resources on essential services like emergency care and maternity, expand telehealth. Thoughtfully, remote visits, monitoring, and virtual coaching extend care. Requires investment in broadband, training, and user friendly platforms. Not a replacement for in person care, but a critical supplement. Regional collaboration networks, hospitals, and providers pool resources for staffing, equipment, and specialty coverage. Shared protocols and coordination reduce redundancy and improve efficiency. Why this matters for patients. Local access is preserved, reducing travel and treatment delays. Care is more coordinated and consistent. Chronic disease management and preventive care remain accessible. Rural communities gain stability without requiring massive system changes. Structural insight. Rural and underserved populations are canaries in the coal mine for healthcare stress. Structural interventions, not political promises, determine whether access is preserved. Centralized support, telehealth, and collaboration provide practical, achievable levers. Protecting care in these areas also reduces systemic costs, fewer preventable hospitalizations, emergencies, and complications. Next, we'll close the playbook with Post 6, Technology and Telehealth Optimization, showing how thoughtful tech can further enhance care without adding unnecessary complexity or cost. Healthcare in America, Structural Reform, Playbook Post 6, Technology and Telehealth Optimization. Technology in healthcare is often talked about as the next big fix, but without careful design, it can add complexity instead of reducing it. When implemented thoughtfully, tech and telehealth can improve access, coordination, and outcomes, completing the reforms outlined in this playbook. Why technology matters. Electronic health records, EHRs, and data integration reduce duplication and improve continuity. Telehealth expands access for rural and underserved communities. Remote monitoring supports chronic disease management and preventive care. Technology is a tool, not a solution in itself. Used strategically, it amplifies other structural reforms: integration, transparency, and incentive alignment. Key levers: streamlined telehealth platforms. Simple, user-friendly interfaces for patients and providers. Integration with EHRs to ensure continuity and data flow. Focused use for follow-ups, consultations, and chronic disease monitoring. Remote patient monitoring devices track blood pressure, glucose, heart rate, and more data. Feeds into provider dashboards for timely interventions. Reduces preventable hospitalizations and complications. Data integration and analytics, unified patient records, improve care coordination. Analytics identify high-risk patients and resource gaps. Supports evidence-based decision-making and oversight. Why this matters for patients. More convenient access to care, especially in rural or underserved areas. Reduced travel and wait times. Better tracking of chronic conditions and preventive measures. Fewer surprises in billing or treatment, thanks to integrated systems. Structural insight. Technology alone won't fix systemic inefficiencies, but it enhances the levers already discussed. Integration becomes more effective. Administrative burden is reduced. Incentive alignment and preventive care are easier to track. When combined with oversight, transparency, and coordinated care, technology turns abstract reforms into real-world improvements that patients can see and feel. Closing the playbook. This concludes the Structural Reform Playbook. Administrative oversight and waste reduction price, transparency and negotiation, integrated care and coordination incentive alignment for prevention and chronic disease, rural and underserved access technology and telehealth optimization. The series shows that practical, achievable reforms exist, even without overhauling the entire system. Small structural changes applied thoughtfully can reduce friction, preserve access, and improve outcomes.